Hi everyone, this is Patricia with Mental Health Matters, and tonight we're going to be continuing our series on alcoholism. And so you have decided with your family and your physician to go into treatment or rehab. So I'm going to take you now through what to expect for the first 4 or 5 hours while you're here with us in a hospital setting. Okay, so your doctor usually will make referrals, and he may be on the staff at one of the hospitals, and there you go. He will be your admitting physician. He will be the number one leader on the team, and there is nothing that will happen that doesn't have his approval. So, you're in good hands. So as you approach our hospital, due to COVID, you will be required to wear a mask at all times. And the first thing that the nurse will do as she meets you is give you a COVID test. Hopefully you will be negative, and that will be the end of that. But unfortunately, if you do show a temperature and some signs of COVID, you cannot be admitted to most facilities, and you will be then transported to a medical facility in which you can get treatment for COVID. All right, so here you are with your luggage and your mask on, and maybe not feeling all that great. You have maybe flown from another state, or a family member has driven you and dropped you off, but here you are. And I know that it feels a little bit overwhelming. And so I want to reassure you that everyone that works in hospitals that treat substance abuse and mental health issues are highly trained, very dedicated, and really care about their patients. So there's no need to feel anxious or worried. You're going to be in good hands. All right, so as you come through our doors, you're going to be meeting someone from admissions. They will do a lot of questions with you and ask you a lot of issues about why are you here, what is it you need. Let's take a look at your insurance and see if you can stay for 7 days, or will you be here with us for a whole lengthy 30-day treatment program. That's all depending on your doctor and your insurance and you. All right, so remember now, you're going to be starting to go through withdrawals and starting to feel uncomfortable, which is pretty normal. So after you have met with the admissions office and your suitcases have been taken, they have been examined, your medications have been ordered by your psychiatrist, and next comes they will search you to make sure that you're not carrying any drugs or alcohol or contraband on your body. You'll then be put into some pajamas or sweatpants, something from your luggage that is really comfortable. All of your vital signs will be checked by nursing, including, your blood pressure, your temperature, things like that. A drug screen will be asked for, and you will have, that's part of being admitted, and you will have to provide that for nursing. That will be sent out usually to the lab. So let's see, vitals, and you'll be meeting your nurse, you'll be meeting admissions, and now you're going to go down to your room. You probably will have a roommate, unless you're very fortunate to have the room to yourself. Every hospital has separate wings, and so one wing is for detox only. And there's a reason for that, because as I mentioned earlier in a previous video, when you're going through detoxification, the body and the mind really have symptoms that are very physical, they're very real, and you really need to be monitored. So, for example, you may feel nauseous, you may actually vomit, you may have chills, you may start sweating. You may have hallucinations if you try to lay down and all of a sudden you're seeing things in the room that really aren't there. And you may also be prone to seizures, and that's all a big concern for all of us as you go through detox, which is why we put most of our patients all together so they can be closely monitored. Your doctor will probably put you on what's called a Q15, and that means that the medical technician will be with you and checking on you every 15 minutes. It may seem quite annoying in the beginning because you're trying to rest, but it's really her job to make sure you're okay and to see if you need anything. During the admission process also, we will be asking about your balance and if you're prone to falling. If so, then a wheelchair will be provided, and we'll be asking you to stay in it for a day or two just as you go through detox to make sure that your balance is okay and that you don't trip and fall. That would be not something that I would want anyone to happen. So as we're going through your personal belongings, you're going to take out some socks to keep your feet warm and some shoes. You always have to have something on your feet. During the admissions process, also, all of your personal belongings will be taken. Your phone, for example, and the charger and lighters, if it is a smoking facility. Cigarettes you're able to have, but certainly not the lighter. Any other contraband that we find will be taken and locked up in safes. Your luggage will be locked up also. Your wallet, your money, any jewelry, which we highly recommend you don't bring with you, will all be taken and put safely, usually in an envelope and locked up in the safe. We really don't want you to bring a lot of money to the hospital. You will be asked to show some identification, but after that you really don't need your phone, you don't need credit cards, you don't need your social security card, your insurance cards, any of that. That's all needs to be locked up, and for safety reasons we do that just about every single time. Now, there are phones on the units, and there'll be definite hours in which you will be able to call home. If someone calls you from outside, a friend or a family member, we are instructed due to the HIPAA laws that say that we cannot divulge who is in our facilities. So the receptionist will say, I cannot confirm or deny your presence there. You need to let family know that you're okay by giving them a quick call home. So all of that will be provided. Now you're in your room, you're in your sweats or your pajamas. A snack will be provided. If you've missed a meal, then we'll open the kitchen and get you some food, certainly something to drink, because we don't want you getting dehydrated. It just all depends on what time that you come to us. Now, in terms of most facilities that I've worked in, we have vans that come and pick up our patients. We certainly don't want you driving under the influence. And so that's as a courtesy, we will pick you up and we will drive you home. Now remember, due to COVID, a mask is going to be required for you to wear every time you leave your room. And all staff will be wearing masks as well. Social distancing will be required. You'll be asked to stay 6 feet away from other patients and certainly other staff as well. But for the most part, you're going to settle in that very first night. You're going to be taking your medications as prescribed by your physician, who you will probably see the next day. You will also be given a listing of all of the program that's here in terms of your groups, your smoking breaks, when you have recreation, when you meet with your doctor, when you meet with your medical physician. All of that will be given to you, but usually not on the first day that you're here. This is just a time to get you settled in, and it can feel very overwhelming for the patient. So we usually wait until the next day to go through what the procedures are, the rules and regulations, and you'll probably meet your therapist then, and you'll also meet your medical doctor, and you'll see your psychiatrist. All right, I know there's a lot of information, but mainly I want you to hear that the people that have chosen to work in this field of substance abuse and mental health are highly trained, and they're skilled. They're good people that really work hard to make your stay comfortable, effective, and remember that at the beginning it's always the hardest, but the ending is so worth it. So stay in treatment, whether it's 7 days or 30, And it does get easier over time, I promise. All right, so I'm going to come back in the next day or two, and I'm going to tell you what day 2 is like. Now remember, if you don't sleep that first night, that's okay. You'll catch up over time. Your body's going through a lot with detox, and it may make you have some uncomfortable feelings. So just grin and bear, go to nursing, go to the nursing station. There's always somebody there 24 hours a day around the clock to help you. So, and nothing will ever happen without your doctor's approval. So we are in constant contact with him or her, and they know you really well, hopefully. And like I say, there's nothing for you to be afraid of. There's no need for you to feel anxious or even overwhelmed. You're on the road to recovery now. And I just want to say welcome. I'm glad you made it here. All right, this is Patricia with Mental Health Matters. We're talking about alcoholism. You can catch me on YouTube, A Slice of Peace with Patricia. Have a great night, everybody. It's Friday here where I am, and I hope you're staying safe out there. Thanks so much for following me. Thank you for listening, and I hope this has been helpful. If you know someone who's heading towards rehab or towards treatment, please let them see this video. I hope that I have reassured you there's nothing to be frightened about. It's all going to be okay. All right, bye for now. Patricia, Mental Health Matters. Take good care.